Hey, what's up, everybody? I just wanted to lay out some information and try to present it in a way that may help people start to see through this. It's getting carried out to the point where our way of life is probably never going to be the same, hence the new normal. And this sucks for everyone, but I especially feel terrible for the kids on where this may go. So I'm basically just going to run through the information that I've come across. Most of it the mainstream media is not sharing with us. So this has nothing to do with left versus right. It's purely based on what's actually taking place in the world. So we will start at event 201. This was hosted by the Johns Hopkins Center for Health and Security, and they partnered with the World Economic Forum and the Bill and Melinda Gates Foundation. This was a high-level pandemic exercise on October 18th in 2019 in New York City. The exercise illustrated areas where the public-private partnerships will be necessary during the response to a severe pandemic in order to diminish a large-scale economic and societal consequences. You'll see the people involved here. Obviously, Bill and Melinda Gates Foundation, Johns Hopkins University, United Nations Foundation, United States Center of Disease Control, China Center of Disease Control, United States National Security, U.S. Medical Group, Marriott International Hotels, the World Bank Group, U.S. Health and Metrics Evaluation, Edelman, which is a global communications firm, Lufthansa Group Airlines, UPS, and Johnson & Johnson. Okay, what I did here was just take screenshots of the presentation, which you can find on YouTube. It's about 5 minutes long, of what occurred here. So you start out with the coronavirus starting in a pig, and it's going to produce mild flu-like signs and severe pneumonia. They name it coronavirus-associated pulmonary syndrome, CAPS. And they start off saying the virus can be transmitted through the air and all people are susceptible. It could lead to a severe worldwide pandemic. Shows it starting in Brazil, spreading across the globe. Antivirals and critical medical supplies must be distributed globally. And travel and trade restrictions are having profound economic consequences. The pandemic is causing a global financial crisis. Misinformation is undercutting efforts to control the pandemic. And that was a large part of this presentation about how they needed to control what they would call disinformation, or what realistically is anything against their narrative. Anybody who might have a different opinion, they want silence. They don't want to be heard. And then we're over at the global economy in free fall, which seems like where we're going to be in a few months. And then the economic turmoil could last a decade. Okay, so based on all of that, it seems like kind of identical to what we're living through right now. The timing was very coincidental. The coronavirus broke out in China less than 1 month after this exercise took place. And again, if you look at pretty much all the topics that they discussed during this, it's basically in line with what we're living through right now. So we'll move on to the real information. Just wanted to present that to people because I don't know how many people are aware that this actually occurred. And again, the timing was strange to me, just less than 1 month prior to the whole world shutting down. Okay, so February 28th, prior to it actually arriving here, Trump calls the coronavirus the Democrats' new hoax. And then on March 21st, Mike Pompeo, who is the Secretary of State, prior to that, he was the director of the CIA, says in a live interview that we are in a live exercise, which was kind of strange wording. 9 days later, March 30th, Neil deGrasse Tyson says the coronavirus is an experiment in whether the world will listen to scientists. So also kind of a strange way to put it. And then apparently Dr. Fauci, who we all know and love, had warned us of this in 2017. Dr. Anthony Fauci, the U.S. government's top infectious disease specialist, warned in early 2017 that there would be a surprise outbreak that would occur during the Trump administration. There is no question that there will be a challenge to the coming administration in the area of infectious diseases, he said at Georgetown University just days before Trump was inaugurated. So, moving on from PubMed.gov, potential false positive rate among asymptomatic infected individuals in close contacts of COVID-19 patients. False positive, they state, is 80.33%. So 4 out of 5 positives are false positives. This is from the CDC's website. It's the National Vital Statistics System, March 24th, 2020. The question is, should COVID-19 be reported on the death certificate only with a confirmed test? And their response is, COVID-19 should be reported on the death certificate for all decedents where the disease caused or is assumed to have caused or contributed to death. Moving on, April 7th, CDC tells hospitals to list COVID-19 as cause of death even if you're just assuming or it only contributed. And then in another article, CDC tells hospitals to list COVID as cause of death even if there are no test results confirming it. And here on April 8th, so the U.S. pneumonia deaths weekly, you could see for it's like about 6 years in a row, it stays pretty consistent. It's kind of the middle of the winter here. And then looking on first week of the year, when COVID supposedly was coming through, I guess like mid-February, should be somewhere right over here. But you'll just see this red line that's this year, 2019-2020, literally just dropping straight down because now pneumonia deaths are being called COVID deaths, just to inflate the numbers. And April 11th, U.S. hospitals getting paid to list patients as COVID-19. This was after Dr. Scott Johnson, a Minnesota physician and Republican state senator, told a local station he received a 7-page document coaching him to fill out death certificates with a COVID-19 diagnosis without a lab test to confirm the patient actually had the virus. Down here, so it was $13,000 per COVID patient that the hospitals receive, and $39,000 per COVID patient on a ventilator is what he quoted. And then here we have a state-by-state breakdown of federal aid per COVID case. This is from BeckersHospitalReview.com. This was April 14th. So find the state you live in and take a look. I'm over in Illinois. Illinois, $73,000 per case. There's also a more recent article from Becker's Hospital Review that shows the total amount of money that each state has received and kind of gives a breakdown of how many hospitals it's distributed from. Okay, and then these articles here are pretty telling. April 20th, the Director of Health in Illinois, Dr. Ngozi Ezike, said, if you were in hospice and had already been given a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means technically if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that they was their cause of death, but that they had COVID at the time of their death. April 7th, Dr. Birx, who is the head of the U.S. Task Force fighting coronavirus, says government is classifying all deaths of patients with coronavirus as COVID-19 deaths, regardless of cause. So just more of the same. May 25th, gunshot victims counted as Washington coronavirus deaths. And then below here, an interview on Joe Rogan with Elon Musk, May 7th. I'm just showing you his side of it. Elon Musk, a bus. If you get hit by a bus, you go to the hospital and die, and they find that you have COVID, you will be recorded as a COVID death. So I thought that was interesting. All right, and then Bloomberg, March 18th. 99% of those who died from the virus had other illnesses, Italy says. So that's where it was hit really hard, kind of at the beginning of this whole thing. Italy is known to have kind of an older population, but if you look at this tiny little sliver, this yellow sliver, you probably can't see it right on top, 0.8% had no other illness. So COVID was the cause of death for the 0.8%. Moving over, March 11th, Gateway Pundit, should be a headline, German autopsy study finds every coronavirus victim had previous illness. All had cancer, lung disease, were heavy smokers, or morbidly obese. Time on April 23rd, almost every hospitalized coronavirus patient has another underlying health issue, according to a study of the New York patients. The median age was 63 years old, and 94% of them had at least one comorbidity, meaning that they had at least one other disease in addition to COVID-19. And then April 28th, report over 95% of UK COVID deaths had pre-existing conditions. So all, the same exact narrative. Okay, May 11th, NPR, Tanzania's president blames fake positive tests in the spike of coronavirus cases. They tested non-human samples, including a goat and pawpaw. These tests were given human names and ages as they were sent off for results. They tested positive, a fruit and a goat. President Magufuli said, something is happening. Accuracy of coronavirus tests, question after PGA golfer tests positive and then negative. May 21st, The Telegraph, tens of thousands of coronavirus tests have been double counted, officials admit. 2 samples taken from the same patient are being recorded as 2 separate tests in the government's official figures. And the CDC confesses to lying about the COVID-19 death numbers. And then I saw this tweet and kind of put this all together to put things in perspective, to try to help people see what's actually happening here. The tweet was, New York City has 11,000 COVID deaths. Tokyo, the world's largest and densest city, has 93. New York City is locked down. Tokyo was never locked down. Both have had the virus for the same amount of time. Why is New York City's death rate 250 times higher than Tokyo's? So went to a couple other places around the world. Vietnam, you can see, is bordering China. It's a third world country. 97 million people live there. They've had 0 deaths. 0 deaths. Taiwan, which is 2.5 hours from China, 24 million people live there, 7 deaths total. That's 1 out of every 3.5 million people. Hong Kong, one of the most densely populated cities in the world, 7.45 million people living there, 14 deaths, or 1 out of every 532,000 people. India, one of the most poverty-stricken countries in the world, population 1.36 billion, 28,000 deaths, so 1 out of every 48,000 people. And then we work our way over to the United States, New York City, see a picture above of an empty field hospital, 32,000 deaths through a population of 8.4 million. So that's 1 out of every 262 people in New York City are dying from coronavirus. So, I mean, the question is, what's more likely? Is coronavirus, picking where it's going to go, and just happens to be in our country here, or the United States, I should say. And then I also wanted to make a note that there were a lot of people walking around documenting what hospitals actually look like. So the things you don't see on the news, you'll see a lot of videos on YouTube. I'm sure most of them have probably been taken down at this point. People just walking through, showing their own experience, and a lot of these hospitals, they said, were overflowing in New York City on the news, seemed very, very slow. There was even one person, Jason Goodman, was walking around interviewing people outside of the hospitals, and it just seemed like another day. So, strange. Thought these two were interested. May 20th on Fox News, the CDC now says coronavirus does not spread easily via contaminated surfaces. And also June 8th, the World Health Organization just obliterated every argument for mandatory vaccines or contact tracing by declaring asymptomatic carriers don't spread COVID-19. The actual interview, the lady with who, I believe she said, they rarely spread COVID-19. So this is slightly exaggerated, but at least you're seeing the other side. You're not seeing, what they're telling us on the TV. And then May 30th, German official leaks report coronavirus is a global false alarm. June 1st, Russian COVID chief. It's just the flu with minimal mortality. Why has the whole world been destroyed? That I don't know. Ex-Minister of Austria denounces COVID manipulation, media scare tactics, and calls out to the government. Wake up and take action. And June 2nd, Washington Post. COVID-19 turning out to be a huge hoax perpetrated by the media. In May 25th, The Blaze, the CDC confirms remarkably low coronavirus death rate. Where's the media? And down here in the fine print, you'll see the death rate for those with symptoms is 1 in 5,000, which would be 1 in 6,725, as almost all of those have had died with comorbidities. Those without them are more likely to die in a car accident. And then beneath that, and school children are more likely to get struck by lightning. April 1st, the story came out. CBS admits to using footage from Italy in New York City coronavirus report. So going back to what I was just mentioning about how they were exaggerating the hospitals, making it look like a war zone, they had actually been caught and admitted to using footage that was filmed in Italy, because Italy did have some fuller hospitals, and presented that as, I believe it was Elmhurst Hospital in New York City maybe, but one of them. And then another one here, May 9th, 2020, Cherry Health CEO and board president admit the health center staged a COVID-19 test line for CBS News. This in the interview said the people that were in line were not being tested, but they were employees pretending to be patients. So again, just building the craze, making things look busy, everything's chaos, go get your test, just scaring people, just more scare tactics. Okay, and then from the CDC's website, June 30th, 2020, if you test positive. So I thought this was interesting here. A positive test result shows you may have the antibodies from an infection with the virus that causes COVID-19. However, there is a chance a positive result means that you have the antibodies from an infection with a virus from the same family of viruses called coronaviruses, such as the one that causes the common cold. So if you have the common cold, you could test positive. Here is the new probable case definition. So in the yellow down here, FDA approved positive lab test, IgG or IgM. And then you'd also have to have something from the clinical criteria in blue, or the EPI link. So the clinical criteria is at least 2 of the following symptoms: fever, chills, rigors, headache, sore throat, etc. Or at least one of the following symptoms: cough, shortness of breath, difficulty breathing, or severe respiratory illness with at least one of the following: clinical or radiographic evidence of pneumonia, or acute respiratory distress syndrome, and no alternate more likely diagnosis. Okay, so that's clinical criteria. Or it could be the EPI link, which is in green down here: close contact with a confirmed or probable case, or close contact with a person that's clinically compatible illness and linkage to a confirmed case, or travel to a residence in an area with sustained and ongoing community transmission of COVID. So now, if you have the blue and the green only without a test, meaning, a sore throat, and you've been in contact with somebody who is positive, you are able to be counted as a probable case of COVID-19 without the test. Here's a graph that kind of makes it easier to understand the new probable case definition. You have the one confirmed case in the middle, that had the one person that had the positive lab result, and then you move over to the left, the household. There are 3 probable cases from that. The friend that he came in contact with, the friend has a cough within 14 days of contact. That's one additional probable case. You have the neighbor that reports having a sore throat and a headache within 14 days. That's another probable case. His coworker or her coworker reports feeling fever within 14 days. That's another one. And then now you have the coworker's family that they live with, maybe 3 additional people, working back to the neighbor who is the 1 additional probable case. The neighbor has a family they live with, so let's say 3 additional people, they report a cough, 3 probable cases, and now it moves on to the neighbor's coworkers, who, let's say 4 workers, for example. So you see how this entire thing just expands insanely from nothing, and these are all probable. So it's the 1 confirmed case, and now you're looking at 16 probable cases. So when you work your way to the neighbor's coworkers' families, and down the line, it basically would just be every single person. It's going to be COVID probable at some point. This is an example of a death certificate. Immediate cause of death, leukemia. Sequentially list conditions, if any, leading to the cause listed on line A. Enter the underlying cause, disease, or the injury that initiated the events resulting in the death last. So leukemia was the immediate cause, and then there was cardiac arrest, and then possible COVID. Okay, so again, without the test, you could be possible COVID, and that death is now going to be marked as a COVID death. So if you look at the new case definition, the example death certificate above is sufficient and will be counted as a COVID-19 related death. Positive PCR test results are no longer required. So the number of COVID-19 related deaths is going to increase because of the new case definition. Saw this article today, actually. It was from July 14th from the National. It's Argentina stumped as sailors catch COVID-19 after 35 days at sea. So Argentina is trying to solve a medical mystery after 57 sailors were infected with the coronavirus after 35 days at sea, despite the entire crew testing negative before leaving the port. According to the ministry, 57 of the 61 crew members were diagnosed with the virus after taking a new test. However, all of the crew members had undergone 14 days of mandatory quarantine at a hotel in the city of Yeshua, maybe. Prior to that, they had received negative results, the ministry said in a statement. So literally out to sea, and they got COVID. It's almost like COVID's inside of us already. And then also July 14th, Fox 35 investigation reveals inflated Florida coronavirus numbers. 22 labs reported 100% positivity rates. 2 labs reported 91.18% positivity rate. So countless labs have reported a 100% positivity rate, which means every single person tested was positive. Other labs had very high positivity rates. Fox 35 found that testing sites like CentraCare reported 83 people were tested and all tested positive. Then the NCF Diagnostics in Alachua reported 88% of the tests were positive. The report showed that Orlando Health had 98% positivity rate. However, when Fox 35 News contacted the hospital, they confirmed errors in the report. Orlando's health positivity rate was only 9.4%, not 98%. The report also showed that the Orlando Veterans Medical Center had a positivity rate of 76%. A spokesperson for the VA told Fox 35 on Tuesday that this does not reflect their numbers and that the positivity rate for the center is actually 6%. Interesting. July 21st, 12 doctors were arrested in Mexico for faking at least 800 documents to increase corona-related deaths. And then more states reverse or slow reopening plans as coronavirus cases climb. I wonder why. July 20th, CDC admits false positives are being mistakenly included in official coronavirus data. On July 26th, uncovering a gunshot, Parkinson's, and a hip fracture as mislabeled COVID-19 deaths. So Palm Beach County Medical Examiner COVID deaths. They ended up finding 8 deaths were incorrectly labeled as COVID deaths, including one was a gunshot wound to the head. Okay, and I'd like to take a quick break from all of the real information so that we can relax a little. Remember, the the dancing nurses who are working so hard, healing all these people in, again, these war zones, middle of a pandemic. Everyone's dying everywhere, and they have time to synchronize dances, make all these funny videos. The people in the middle here were supposedly carrying a dead COVID patient through the hallway dancing, has COVID-19 written on the body. And clearly a lot of work went into these dance routines. So just wanted to pay them their dues on that. Here's some more incompetence. Fox News, March 31st. Coronavirus tests bound for United Kingdom become contaminated with coronavirus. June 20th, Washington Post. CDC coronavirus test kits were likely contaminated. Federal Review confirms. And then July 20th, AP News. Connecticut says it found testing flaw, 90 false positives. So DPH said that the affected patients were originally tested between June 15th and July 17th. A total of 144 tested positive and 90 were discovered to be false positives. The state has reported the flaw to the manufacturer and the Federal Food and Drug Administration. In a written statement, the agency said the exact cause of the false positive result is still being investigated. So they still don't know. All right, let's work our way over to the masks now. So Business Insider, World Health Organization says there is no need for healthy people to wear face masks, days after the CDC told all Americans to cover their faces. Beneath that, on the World Health Organization's website, there is limited evidence that wearing a medical mask by healthy individuals in the households or among contacts of a sick patient or among attendees of mass gatherings may be beneficial as a preventative measure. However, there is currently no evidence that wearing a mask, whether medical or other types, by healthy persons in the wider community setting, including universal community masking, can prevent them from infection with respiratory viruses, including COVID-19. Then the New England Journal of Medicine. We know that wearing a mask outside healthcare facilities offers little, if any, protection from infection. And below, thehealthyamerican.org. Science says people should not wear masks. Masks reduce intake of oxygen, leading to carbon dioxide toxicity. Germs are trapped near your mouth and nose, increasing risk of infection. Wearing a mask causes you to touch your face more frequently. There is no scientific evidence that supports healthy people wearing masks. Okay, and here's a graph that shows the main symptoms of carbon dioxide toxicity and what volume and air percentage would be leading to each condition. And above that, this is hypercapnia. It can be caused by rebreathing your own exhaled CO2 by wearing a mask continually. And over here we have a surgeon of 30 years talking about masks. COVID virus particle size averages at 125 nanometers, which is 0.125 microns. The range is generally in between 0.06 microns to 0.14 microns. One needs an electron microscope to see the COVID-19 virus particle. So the hoarded N95 mask filters down to 0.3 microns. So N95 masks block few, if any, virions, virus particles. This is a simple fact, so you cannot argue against it. Other surgical masks, homemade masks, and handkerchiefs do the following. 1. Allow free passage both ways, in and out of COVID-19 virions. And 2. They become a warm, damp, or moist reservoir of COVID-19 particles in asymptomatic carriers, estimated to be 85% of all people tested. For surgeons, years of training, intimidation, and humiliation teach us to touch nothing but our surgical field. People constantly touch, rearrange, and manipulate their masks, wonderfully inoculating thousands of virus particles onto their bare, or even worse, gloved hands. Okay, and then above that, you'll see two images of masks. First one, it says, this is the mask needed to prevent the virus inhalation and absorption through the eyes. And up on the upper right, this is a mind control device, part of a pandemic psyop. And next we have OSHA, which is the Occupational Safety and Health Administration, which they protect workers from health and safety hazards on the job. They require a minimum of 19.5 oxygen level in a working space. So the normal oxygen levels are anywhere in between 20 to 21. So the gentleman in the center pictures first tested the air quality without a mask and came in as 20.6, and then later on tried it with a mask on, and he ended up at 17.5. And if you're watching the video, there is an alarm sounding the entire time the oxygen level is under 19.5, and then it turns off once the oxygen level gets back to 19.5. Okay, and then on the right side we have Ohio House of Representatives, Nino Vitale. This video apparently was removed from YouTube. Obviously still find it somewhere. I took these screenshots prior to that happening. But he tested 3 different masks, and the first one was a thin cloth mask, and all of these occurred within 5 seconds of these children wearing these masks. So the thin cloth mask came in at 17.0, the N95 came in at 18.1, and then the surgical mask came in at 17.6. Next we have an article from April 24th. Driver wearing N95 mask for several hours passes out, crashes into pole, police say. May 7th, 2 Chinese boys reportedly die within 1 week of each other while wearing face masks in gym class. May 24th, jogger's lung collapses after he ran 2.5 miles while wearing a mask. And finally, I just thought it was funny, on the box of, I think they were cotton masks, you'll see on the back, it says this product is an ear loop mask. This product is not a respirator and will not provide any protection against COVID-19 or other viruses or contaminants. And that's what the majority of people are wearing today. All 3 of these articles were on July 9th. DeWine mask order won't apply to lawmakers, judges, and staffs. So a spokesman for Governor Mike DeWine of Ohio on Wednesday said that even though the governor ordered people to wear masks inside Franklin County's public spaces, that order won't be enforced against some of the state's most public people inside of the state's most public building. Okay, and then over here in Texas, San Antonio, this man said you should consider wearing a mask even when you're in your own home if you cannot socially distance with other family members. And then finally, New York Post, Colorado town threatens a year in jail for residents who refuse to wear masks. May 7th from NPR, U.S. field hospitals stand down, most without treating any COVID-19 patients. The endeavor cost more than $660 million, according to NPR analysis of federal spending records. But nearly 4 months into the pandemic, most of these facilities haven't treated a single patient. So if you look to the right, it shows all 17 of the facilities that were set up. Just go through a few of them. Here's Sunny Stony Brook, $155 million, 0 patients. Sunny Old Westbury, $118 million, 0 patients. McCormick Place in Chicago, which is this picture, just about $66 million, 37 patients total. Westchester County Center, New York, $47 million, 0 patients. Colorado Convention Center, $34 million, 0 patients. And if you keep going, you get more of the same. So you get the point. May 9th, United States healthcare sector has shed 2 million jobs in a pandemic. California hospitals lacking non-COVID patients, laying off staff amidst pandemic. May 25th, wealthiest hospitals got billions in bailout for struggling health providers. 20 large chains received more than $5 billion in federal grants, even while sitting on more than $100 billion in cash. And this is just a small clip of that article. But it says, but the formulas to determine how much money hospitals receive were based largely on their revenue, not their financial needs. As a result, hospitals serving wealthier patients have received far more funding than those that treat low-income patients. And then June 8th, New York Times again, hospitals got bailouts and furloughed thousands while paying CEOs millions. Okay, Zero Hedge, April 29th. America's super rich see their wealth rise 282 billion in 3 weeks of pandemic. April 30th. Coronavirus has made Jeff Bezos $33 billion richer as Amazon reports quarterly profits. June 4th. Jim Cramer. The pandemic led to one of the greatest wealth transfers in history. June 18th. Billionaires get $583 billion richer since coronavirus began. Sales soar at Walmart and Home Depot during pandemic. And on the flip side, small businesses close, watch the big box stores thrive. April 13th, 43% of small businesses say they'll be forced to close permanently if they don't get help soon. May 6th, EU faces recession of historic proportions, economic forecast warns. May 7th, Bank of England warns coronavirus crisis will see GDP slump nearly 30% in the first half of this year and push the economy to worst recession in 300 years. May 12th. Small businesses used to define America's economy. This pandemic could change that forever. More than 100,000 small businesses have closed forever as the nation's pandemic toll escalates. June 2nd. The U.S. economy could take nearly a decade to recover from coronavirus pandemic. June 4th. Bankruptcy Institutes. The American Bankruptcy Institute said Thursday that U.S. Chapter 11 bankruptcies in May ballooned by 48% compared to a year ago. June 8th, black business owners rank collapsed by 41% in U.S. lockdowns. June 14th, 85% of independent restaurants may go out of business by the end of 2020, according to the Independent Restaurant Coalition. And then if you look, there's a picture of the cover of The Economist magazine in April, after the disease, the debt, and it shows somebody carrying the corona ball on their back, walking straight uphill. More results predicted to occur because of the shutdown. May 13th, lockdowns have sentenced up to 1.2 million children under 5 to death, says UNICEF. May 5th, as we previously highlighted, a data analyst consortium in South Africa found that the economic consequences of the country's lockdown will lead to 29 times more people dying than the corona itself. May 13th, 6.3 million will develop tuberculosis as a result of the COVID-19 lockdown. 1.4 million will die. May 7th, professor, economic impact of lockdown will cause more deaths than coronavirus. And April 1st, suicide versus coronavirus deaths. Study finds coming economic crisis could lead to 831,600 suicides. That is 4 times the number of estimated coronavirus deaths. April 30th, Hitchens, COVID warning. Freedoms taken away may not be restored. March 27th, Edward Snowden says COVID-19 could give governments invasive new data collection powers that could last long after the pandemic. May 14th, The Guardian, global report, World Health Organization says COVID-19 may never go away and warns of mental health crisis. And June 30th, CDC doctor warns this is the beginning of the coronavirus on June 30th. April 13th, we need an army. Hiring of coronavirus trackers seen as key to curbing the disease spread. That was in New York. May 7th, it begins. California official announces program to remove people with COVID-19 from their homes to quarantine centers. Sky News, test and trace system to launch this week after 25,000 contact tracers recruited. And Trump says he would mobilize the military to distribute coronavirus vaccine when it's ready. And this was an ad somebody found on Indeed. Social distancing security officer. It says job type is permanent. So that is what we're looking at right there. This disease will never go away. And just thought of this quote from Ronald Reagan. The most terrifying words in the language are, I'm from the government and I'm here to help. So how is this possible? Why all the lies on the TV? May 21st, 2012, the NDAA legalizes the use of propaganda on the United States public. U.S. repeals propaganda bans, spreads government-made news to Americans. It says, for decades, a so-called anti-propaganda law prevented the United States mammoth broadcasting arm from delivering programming to American audiences. So not anymore. U.S. ends ban on domestic propaganda. So they're legally allowed to spread propaganda. That's what's going on with this entire thing. And then here is the CIA. You saw Mike Pompeo earlier. He was the director of the CIA. And in a lecture at Texas A&M University, April 15th, 2019, he said, "I was a CIA director. We lied, we cheated, we stole." And he starts laughing. It was like we had entire training courses. So truth right there for people. And there was a declassified CIA document. This document states that the CIA task force now has relationships with reporters from every major wire service, newspaper, news weekly, and television network in the nation, and that this has helped us turn in some intelligence failure stories into intelligence success stories. And it says later on, what we seem to have here is an attempt to manipulate public perception of global events through mainstream media and news publications. But what's perhaps more interesting is the fact that a lot of people are now waking up and seeing through many of these lies and manipulation tactics. Instead of just blindly believing what we hear on television, more people are starting to think critically. So that's hopeful. Another separate article, newly declassified documents reveal Operation Mockingbird is alive and well. It says, having representatives of the federal government attempt to influence and guide the narrative of what is purported to the American public to be a free and independent press can only be described as symptoms of repressive authoritarian system that is out of control. For those unfamiliar, Operation Mockingbird was a CIA operation that began as the Cold War ramped up in the 1950s. In an attempt to gather intelligence and influence public opinion, the CIA recruited journalists from across the United States. The scope of the infiltration of the media was so vast, encompassing newspapers, periodicals, press services, news agencies, radio and television stations, book publishers, and foreign media outlets. It appears that the propaganda relationships are still ongoing between the United States government and the corporate media outlets. So I'd agree with all that. Another important piece of information, the illusion of choice. So the media has never been more consolidated. 6 media giants now control a staggering 90% of what we read, watch, and listen to. And that was in 2011. So 9 years later, it's probably realistically down to like 2 or 3. It says in 1983, 90% of American media was owned by 50 companies. Okay, so 9 years ago, it was down to 6 companies that own all of the information that we read, that we see on TV. Okay, so they're all controlling the information, which makes this a lot easier to understand. And something else people probably don't know about that you should look into. Deep fakes are here. These deceptive videos erode trust in all the news media. So this was May 20th, 2020. In January, Facebook and Twitter published new policies for dealing with deep fakes, or what the industry terms synthetic media, audiovisual clips created with the support of artificial intelligence. These techniques are so effective that it's extremely difficult, often impossible, to tell that the content is fake. Deepfakes are so named because they rely on deep learning branch of artificial intelligence. And just to run through a few examples of how they can manipulate and lie. There's a picture of Anderson Cooper with water up to his waist on the news, pretending as though they're in a heavily flooded city. When you see the cameraman standing up, there might be 3 or 4 inches of water, and there's Anderson Cooper who's seemingly kneeling down in a ditch to show the water's up to his waist. ABC News airs purported Syrian war video, but it's really from Kentucky. So ABC was forced to apologize for claiming this video showed a Turkish attack on Kurdish civilians, and then it later came out that it was a video from a Kentucky gun range. And here's another example. CNN organizing this little protest. They were passing out the signs in advance and lining all these people up, showing them exactly where to stand and what to do. And then the picture below, it was funny to me. It says the newspaper, Putin and the FBI helped Donald Trump get elected. And these two people are here looking at it, reading it, and they're like, even the truth looks like fake news. So that's where we are. YouTube's CEO suggested content that goes against World Health Organization guidance on the coronavirus will get banned. So a lot of heavy censorship here. Google goes beyond Orwell to CCP-style censorship. YouTube's new Ministry of Truth and a deal with Netflix. And then more censorship. Here's a picture of Google. It says Google dictatorship. Earlier today, NBC reported that Google confirmed it financially blacklisted two sites known for criticism on the left: conservative commentary site The Federalist and alternative news site Zero Hedge. So again, just controlling all the information that goes out, which is, brings me back to Event 201. I mean, you saw that was a major factor in how they wanted to handle, that pandemic, which was a month prior to this pandemic. So, all right, now looking at deaths annually. So you have COVID deaths up to this point. In the world, 570,000 people have died from COVID. And we're just going to run through a list of all these other causes of death. Cardiovascular diseases, number one cause of death globally, 17.9 million people each year. 9.6 million people are estimated to have died from cancer each year. 5 to 10 million people die annually from kidney disease. Respiratory diseases, 3 million people die each year. Diabetes, 1.6 million people die each year. And then 1.35 million people are killed on roadways in accidents each year. 800,000 people commit suicide every year. So tuberculosis would probably be the closest match to COVID here. Tuberculosis is a global pandemic killing someone approximately every 21 seconds, about 1.5 million in 2018 alone. So even if we rounded up and said there's going to be 1 million people that die from COVID in an entire year this year, tuberculosis was still a much bigger issue that I'd, heard a little bit about the news 2 years ago, but, it didn't shut down the world. Okay, annually the flu, according to the World Health Organization, kills in between 250 to 500,000 people a year. 445,000 deaths from malaria in 2016. Worldwide tobacco use causes more than 7 million deaths per year. Alcohol kills more than 3 million people each year. If this was about the government caring about people, maybe some other things would be taking place here. This is not really related, but I just heard this recently. I was kind of surprised by it, so I'm going to share it with anybody watching this. January 7th, 2019. U.S. healthcare spending highest among developed countries. And so the cost is the highest. And then July 10th, 2018, among 11 countries, U.S. ranks last in health outcomes, equity, and quality. So paying the most for healthcare and giving the worst quality. And then the third leading cause of death in the United States, most doctors don't want you to know about. It says, a recent Johns Hopkins study claims that more than 250,000 people in the United States die each year from medical errors. Other reports claim the numbers to be as high as 440,000. So that's just the doctors making mistakes. All right, this one is just to kind of lighten the mood. July 9th, BBC, Japan, don't scream and be serious. Japan theme park tells roller coaster riders. Many people might find it tricky keeping quiet through the entire roller coaster ride, but one Japanese theme park wants you to do just that and more. It asks riders to avoid screaming when they go on its roller coasters to minimize spreading droplets and instead scream inside your heart. saw this one and thought it's very appropriate to share. It says, they closed your business, they closed your church, they closed your parks, they closed your beaches, they banned funerals, they banned graduations, they made you wear masks, they banned dads in delivery rooms, but they allow this. It says you were played. Alright, and how history repeats itself. Just about 100 years ago, picture on the left was taken at a Georgia Tech college football game. That's 1918. So that's kind of giving us a peek of the future once football starts. And then upper right says, wear a mask or go to jail. So these people are literally living through the same exact thing that we're going through right now. And underneath, again in the newspaper, wear a mask. We appeal to your civic patriotism to cooperate with us. Probably curb the Spanish flu, right? Here's another cover from The Economist. Everything's under control. Big government, liberty, and the virus. Showing the hidden hand with us on a leash while we have our mask on, walking our dog with its mask on. And then to the right you see Americans in 1944 facing almost certain death. And beneath that, Americans in 2020 facing a 99.9% survival rate. This gentleman with his mask on hiding behind a chair. And then underneath that, it's absolutely ridiculous. You have designated spots in parks. That was in San Francisco. There's social distancing circles. And then in Las Vegas, the homeless are also being kept 6 feet apart. They have designated spots as well. And here you see different types of masks. You have a mask for spray paint on the upper left, a mask for asbestos, upper right, a mask for mining, the lower left, and then you see Fauci wearing the mask for the deadliest virus in history, which is a cloth. Here you will see how Middle Eastern women are forced to wear burqas. And now, do you guys see any similarities? What's going on these days here? Imagine, if you will, a virus so dangerous you have to be tested to know that you had it. And how about, if the media never told you about the virus, would you even know it existed? Answer honestly. And here are some Amish folks. One says, I wonder why COVID has not affected us. And the other answer is, because we don't have TV. This one's kind of sad. We've lost everything, our entire life savings. At least the governor kept us safe. There they are, homeless, in a box, in the alley. The newspaper says coronavirus shutdown continues. Our government is now telling us that we can get the COVID-19 virus, recover from it, but still not be immune. However, simultaneously, they're telling us that a vaccine containing the same exact virus, one they claim they still don't understand, is going to give us that immunity and make us safe. You don't need to be a scientist to see what's really going on here. Here's a quote by Mark Twain. It is easier to fool somebody than to convince them they were fooled. Okay, and that's all I have for this one. If you made it this far with me, I want to thank you. Hopefully you learned some new information or you got something from this presentation. If you know anybody that you think might benefit from watching this, please forward to them. And I'm planning on working on some different topics in the future. So if you guys subscribe,